Your doctor may say your blood pressure looks perfect, 120 over 80, 118 over 76, 125 over 79. And for many people, those numbers sound like victory. But after 65, the word perfect can become dangerous if nobody asks one simple question. Perfect for whom? Perfect for a healthy 45-year-old is not always perfect for a 78-year-old taking 3 blood pressure pills. Perfect on a clinic chair is not always perfect when you stand up at 3 in the morning to use the bathroom. Perfect on paper is not always perfect for your brain, your kidneys, your balance, or your daily life. I'm Dr. Emily William, and today I'm going to explain the truth about blood pressure targets in older adults. Not the simple version, not the one number fits everyone version, the real version. Because for older adults, the best blood pressure is not just the lowest number. It is the number that protects your heart and brain without making you dizzy, weak, confused, or more likely to fall. Stay with me until the end, because I'll show you a simple standing blood pressure test you can do at home before your next doctor visit. It may reveal something your regular office reading completely misses. Before we begin, this video is for education only. Do not stop, reduce, or change your blood pressure medication without speaking to your doctor. High blood pressure can be dangerous, and low blood pressure can be dangerous too. The goal is balance. Now let's begin. Number 1. The biggest lie about blood pressure after 65. The biggest misunderstanding is this: lower is always better. For many younger adults, lowering high blood pressure clearly reduces the risk of stroke, heart attack, kidney disease, heart failure, and dementia. That is real. High blood pressure damages the body silently. But older adults are different. After 65 or 70, your body may not tolerate aggressive lowering the same way it did at 45. Your arteries become stiffer. Your pressure sensors become slower. Your kidneys may clear medicine more slowly. Your risk of falls becomes more serious. Your diastolic pressure, the bottom number, may drop too low. So the question is not simply, how low can we push the number? The better question is, what blood pressure protects this person without harming this person? That is the truth most people are never told. Number 2. Why 120 over 80 is not always the right goal. 120 over 80 is often called normal blood pressure. And yes, for many adults, that is a healthy number. But when an older adult is taking medication to force blood pressure down to that level, we have to ask whether the body is tolerating it. Let me explain with a simple example. Imagine your blood vessels like water pipes. When you are young, those pipes are flexible. They expand and relax easily. But as you age, the pipes become stiffer. The heart may need a little more pressure to push blood upward to the brain, especially when you stand. If the pressure is pushed too low, the brain may not get enough blood for a few seconds. That is when you feel dizzy, lightheaded, weak, unsteady, foggy, like the room is moving, like you might faint. And here is where danger begins. A young person may recover from dizziness. An older adult may fall, break a hip, hit their head, lose independence, and never fully return to the same life. So a perfect number that causes dizziness is not perfect. Number 3. The two numbers mean different things. Blood pressure has two numbers. The top number is systolic pressure. This is the pressure when your heart pumps. The bottom number is diastolic pressure. This is the pressure when your heart relaxes between beats. Most people only watch the top number, but in older adults, the bottom number matters a lot. If the top number is high, stroke and heart risk can rise. But if the bottom number becomes too low, blood flow to the heart and brain may become a problem, especially in people with artery disease. For many older adults, a diastolic number that is consistently below 60 should be discussed with a doctor, especially if there is dizziness, chest discomfort, weakness, falls, or fatigue. So do not only ask, is my top number good? Ask, is my bottom number too low for me? That question can change the conversation. Number 4. What research actually shows? One major blood pressure study called SPRINT found that intensive blood pressure treatment lowered cardiovascular events in selected adults at higher heart risk. But here is the part people forget. Not every older adult in real life looks like the people in that trial. Some studies exclude or limit people with certain conditions, frailty, dementia, advanced illness, or complex medical situations. So when the results are applied to every older adult without context, problems can happen. Lower blood pressure may reduce heart and stroke risk in some older adults, but aggressive treatment can also increase the chance of dizziness, fainting, kidney strain, medication side effects, falls in vulnerable people. This is why modern blood pressure care should be individualized. The best number depends on your age, health conditions, fall risk, kidney function, medications, home readings, and symptoms. Number 5. So what is the best blood pressure for older adults? Here is the honest answer. There is no single perfect blood pressure for every older adult, but there are useful ranges to discuss with your doctor. For a healthy, active older adult who is tolerating medication well, many clinicians aim around under 130/80 if it can be reached safely. For adults over 75 or people with dizziness, frailty, falls, kidney problems, or multiple medications, a less aggressive target may be safer. For some frail adults, especially over 80 or 85, the priority may shift from chasing a low number to preventing falls, fainting, kidney injury, and loss of independence. That does not mean high blood pressure should be ignored. It means the target must fit the person. A healthy 68-year-old walker and a frail 88-year-old with falls should not automatically have the same target. Same number, different body, different risk. Number 6. The hidden danger called orthostatic hypotension. Now let's talk about the problem many people miss. Orthostatic hypotension means your blood pressure drops when you stand up. This can happen when medication is too strong, dehydration is present, nerves are not responding well, or the body cannot adjust quickly. A regular blood pressure reading at the clinic is usually taken while you are sitting. But your life is not lived sitting. You stand up, you walk, you bend, you climb stairs, you get out of bed at night. If your blood pressure looks good while sitting but crashes when standing, the clinic number does not tell the full story. Symptoms include dizziness when standing, blurred vision, weak legs, feeling faint, falls, morning brain fog, fatigue after taking medication. If this happens to you, do not ignore it. Tell your doctor. Number 7. The 3-minute home standing test here is the simple test I want you to ask your doctor about, or do carefully at home if it is safe for you. Use a validated upper arm blood pressure monitor. First, sit or lie quietly for 5 minutes. Check your blood pressure and write it down. Then, stand up carefully. If you are at risk of falling, have someone nearby. Check your blood pressure again after standing, ideally within 1 minute and again around 3 minutes. If the top number drops by 20 points or more, or the bottom number drops by 10 points or more, that may suggest orthostatic hypotension. Write down the lying or sitting number, the standing number, any dizziness, what time you took your medicine, whether you had eaten or drunk water. Bring this to your doctor. Do not use this test to change medicine yourself. Use it to start a smarter conversation. Number 8. Home readings are often more useful than one office reading. One office reading is only a snapshot. Maybe you were nervous. Maybe you rushed in. Maybe the cuff was wrong. Maybe you had coffee. Maybe your bladder was full. Maybe your pressure is higher at home than in the clinic. Home monitoring gives patterns. A useful routine is to check blood pressure at the same times for several days, often morning and evening as your doctor recommends. For accurate readings, sit quietly for 5 minutes, feet flat on the floor, back supported. Arm at heart level. Use an upper arm cuff. Do not talk. Avoid caffeine, smoking, or exercise right before. Take 2 readings 1 minute apart. Then look at the average, not one scary number. Patterns matter more than panic. Number 9. When blood pressure is too high. Now let's be clear, this video is not saying high blood pressure is harmless in older adults. High blood pressure can damage the brain, heart, kidneys, eyes, and arteries. It increases the risk of stroke, heart attack, heart failure, kidney disease, vision problems, vascular dementia. If your blood pressure is regularly high, especially above 140 or 150 systolic, you need medical guidance. And if it is around 180 over 120 or higher, with symptoms like chest pain, shortness of breath, weakness, confusion, severe headache, vision changes, or trouble speaking, seek emergency help. The truth is not, high is fine. The truth is, too high is dangerous, and too low can also be dangerous. Number 10. Signs your blood pressure may be too low for you. Watch for these warning signs: dizziness when standing, fainting or near fainting, falls, unusual weakness, morning confusion, extreme fatigue after taking medication, blurred vision, cold, clammy feeling, unsteady walking, diastolic pressure often below 60. If these symptoms began after a new medication, a dose increase, weight loss, dehydration, or illness, tell your doctor quickly. Medication that was right last year may be too strong this year. Your body changes. Your treatment may need to change too. Number 11. The medication timing problem. Sometimes the issue is not just the dose, it is the timing. Some people take multiple blood pressure medicines at once and then feel weak or dizzy a few hours later. Some take diuretics late in the day and wake up at night to use the bathroom, increasing fall risk. Some take medicine without enough fluids, especially in hot weather. Some lose weight but remain on the same dose. These are all reasons to ask your doctor, is my medication timing right for me? Could this dose be too strong? Should we check standing blood pressure? Is my diastolic pressure too low? Do I still need all these medicines? Good treatment is not just prescribing, it is adjusting. Number 12. The real blood pressure goal. The real goal is not to win a number contest. The real goal is to protect your brain, your heart, your kidneys, your balance, your independence, your ability to walk safely, your quality of life. A blood pressure target should reduce stroke risk without causing falls. It should protect the heart without making the person faint. It should lower danger without stealing daily function. That is what best blood pressure means after 65. Number 13. What to ask your doctor. At your next appointment, ask these questions. What is my personal blood pressure target and why? Does my age or fall risk change that target? Should we check my standing blood pressure? Is my diastolic number too low? Could any medicine be causing dizziness? Should I monitor at home for 2 weeks? Do my kidney function and electrolytes look okay? Should my target be different because I have diabetes, kidney disease, stroke history, or heart disease? These questions turn a quick visit into a real plan. Number 14. Lifestyle still matters. Even if your target is individualized, lifestyle still matters. Daily walking, if safe, reducing sodium, eating more vegetables and potassium-rich foods if your doctor allows, avoiding excess alcohol, improving sleep, managing stress, maintaining a healthy weight, taking medicine consistently. The DASH-style eating pattern is one of the best studied approaches for blood pressure. It focuses on vegetables, fruits, beans, whole grains, low-fat dairy, nuts, seeds, and less sodium. Lifestyle can sometimes reduce the medication burden, but do not stop medicine without guidance. Final message. So what is the best blood pressure for older adults? The truth is this: the best blood pressure is not one magic number. It is the safest number for your body. For some older adults, tighter control may protect the heart and brain. For others, pushing too low may increase dizziness, falls, kidney strain, and loss of independence. Do not chase perfect blindly. Know your home readings, know your standing readings, know your symptoms, know your diastolic number, know your medications, and ask your doctor for a personal target, not a generic one. If this video helped you, comment below. Have you ever felt dizzy when standing up after taking blood pressure medicine? And share this video with someone over 65 who takes blood pressure medication. One better conversation with a doctor can prevent a fall, a hospital visit, or a dangerous mistake.